antiseptic mouthwash. Where does that fall on the list?
Well, I think it's probably one of the worst things you can do. And again, it's not based on opinion, it's based on data. Mouthwash destroys the microbiome, shuts down nitric oxide production because it's killing these nitric oxide producing bacteria. And then what are the consequences of that? We see an increase in blood pressure, which is the number one risk factor for cardiovascular disease, number one killer of men and women worldwide. You lose the protective benefits of exercise. And that's just a short list. You develop a sexual dysfunction because if you can't make nitric oxide, you can't dilate blood vessels, you can't get an erection. And so that's a major problem. And all you have to do is look at the numbers. 2 out of 3 Americans use mouthwash every day, sometimes twice a day. 2 out of 3 Americans have an unsafe elevation in blood pressure. And prescription medication isn't bringing it down because there's no prescription antihypertensive medication that's targeted toward the oral microbiome. Antiseptic mouthwash, fluoride, is absolutely one of the worst things you can do for the microbiome, nitric oxide production, and overall health. I kind of compare it to the chronic use of antibiotics, right? No matter what physician you go to, here in the US or abroad, there was no physician in his right mind that would say, I'm going to give you an antibiotic and I want you to take this every day, sometimes twice a day, for the rest of your life. Why wouldn't they do that? Because today we know that destroying the microbiome, the bacteria that live in and on our body, causes systemic disease. The bacteria that live in and on our body outnumber human cells 10 to 1.